old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. And this evening, we're going to be learning a lot about interventional radiology. I got to tell you, it's a few years of doing this show, I don't think we've had an interventional radiologist. We've had interventional neurologists and interventional cardiologists, and it's just fascinating what goes on interventionally. It's such a more minimally invasive way of doing things than what we were probably used to growing up. So without further ado, I'm going to introduce our guest here. It's Dr. Carlos Sanchez, and kudos to him. He drove up from Miami area, and we're going to talk about everywhere he's from in his office and hospital, where he's on staff locations. But he, like I said, is an interventional radiologist. So Dr. Sanchez, welcome to the program. How are you doing this afternoon?
I'm doing very well, David, and I'm happy to be here.
Thank you, and thank you for making that drive through that South Florida traffic.
It was kind of a nice commute.
It always is. Hold that, put it a little closer to your face there, Dr. Sanchez. There we go. We got the microphone taken care of. Okay, my first question. I know a little bit about radiology, but tell us a little bit about interventional radiology, because that's a little different.
Well, interventional radiology is a subspecialty within radiology. And what we do is we specialize in minimally invasive procedures utilizing imaging guidance. With that being said, that will make the procedure safer and quickly for the patients.
Okay, so I was right when I said minimally invasive.
You are definitely right, on the spot.
Because I always tie in interventionally to minimally invasive, because one of the first things I did, I've come from the newspaper world, but when I got into healthcare PR, I saw interventional cardiologist. I looked it up, and it's the catheter-based treatment of heart disease. And what I learned as I looked more into it, it was different. It was through the arteries, going to the heart that way and working on it rather than an open incision. So this is a field that has been moving. This is like the future is here, right?
Well, it's you are right. It's like interventional cardiologists, only that we do everything but the heart. Okay. So we repair veins and arteries utilizing minimal invasive techniques, and that will shorten the time of recuperation in the patients.
And that's important because less chance of infection. They can return to a quality of life that they were used to before a little quicker because it's a smaller incision. Is that kind of some of the benefits?
That's correct. They will recover faster and with sometimes results even better than the conventional surgery.
Oh, that's great news. And now you said veins and arteries, so everything you do is through a catheter in the vein or artery? Is that how it works?
Well, mostly the part of interventional radiology that deals with arteries and veins is called endovascular surgery. We are trained also for a different type of procedures that does not involve arteries and veins. We were trained to use our expertise to drain infections, do tumor ablations, and even when you have obstructions in the urinary tract too.
That's great. And one of the reasons I want to have you on this show is you're doing something brand new, and I just want to thank Hialeah Hospital first for helping us connect. I had known your name, but the marketing manager and the PR manager over there was great. It's HialeahHosp.com. That's HialeahHosp.com. So the hospital is abbreviated there. So. What is your role there? Are you one of the directors there?
I'm the chief of radiology
Okay,
at Hialeah Hospital.
Okay,
Correct.
chief of radiology. That's great. And that's I've been to Hialeah Hospital many times. An older hospital, great hospital in the Hialeah community. I always remember it because in the waiting room there's the painting of Jesus, and he's got
That's
his
correct.
hand on the shoulder of the surgeon as the surgeon is doing surgery.
That's an amazing picture.
It is really
amazing.
is that is an amazing piece of art. I always like to tell that to listeners and viewers, because if you're ever there, go check it out. It's right in the lobby. I think correct me if I'm wrong, I think the hospital may have been owned by Seventh-day Adventists at one time, and that's where it was left over from there.
Many years ago. That's correct. You're correct.
I've
Yes.
had a few doctors on the show, so I've done a little research from Hialeah Hospital, but
I'm not that old.
no, you're not. You may be younger than me. You look great. So thanks. So I always like to say that again. Hialeah Hospital, 651 East 25th Street in Hialeah, 305-693-6100. It's HialeahHosp.com. Just the hospital is abbreviated. But if you Google them, you'll find it, or look on Facebook or wherever you're finding things out. But one of the reasons what I was finally getting to, I wanted to have you on the show is. And I'll have you explain this, because I think I need to learn more about this as well. Is a new diagnostic radiology technique for kidney dialysis access?
Is more like new interventional
Okay, I had that wrong there.
procedure for the creation of arteriovenous fistula for dialysis patients. It's a different option that has become too light now. After 50 years, I may say, of an old type of surgery. This is done percutaneously. That means through the skin with a very tiny incision. Is a procedure that is done under ultrasound guidance. Is done as an outpatient basis with local anesthesia, without general anesthesia, and with no need of operating room time.
That's great. And that's done right at Hialeah Hospital now?
That's done right at the Department of Radiology at Hialeah Hospital.
Okay, and that is for kidney dialysis?
It's for patients that are suffering from end-stage renal disease that need dialysis to remove all the toxins from the blood.
Wow. That is amazing. And you're doing it just right through the skin. I mean, it's, I guess, do people even feel it? Is there a little local put on there?
They don't even realize after the procedure is done that they actually had a fistula created. There's no scars.
Mm-hmm.
There are about 1 of 9 patients that only get the opportunity to get the fistula created for hemodialysis a year. And with this procedure that we probably will be able to offer the fistula creation to more patients.
That's great. So how does that work if people are interested in learning more? They can just call the hospital and ask about this procedure, and then they can see, all the logistics. Do they take my insurance, this and that? Is that the best way if I give out the main number? If
that
people
would be that correct, yes.
Okay, so let me give out that number. We'll give it out again a few times. 305-693-6100. It's HialeahHosp.com. It's Hialeah and then HOSP.com is the website. There's a ton of information on the website. Located right in the heart of Hialeah, 651 East 25th Street. So if you want to learn a little bit more about this, this is a new procedure. I'm correct saying that, right?
It's a new procedure that It's been performed for the first time in the state of Florida just recently. I'm one of the 15 physicians in the country performing the procedure as is today. This is something that will change dramatically the way these patients are treated. I have a great passion to help patients, and especially the dialysis patients. I think that in a way they have been neglected, I would say, in terms of treatment. And like I said, I mean, we have about 100,000 patients a year, new dialysis patients, and only about 20% they get the fistula creation, which is the standard of care and the treatment of choice for these patients.
So the normal option for dialysis, is it done normally through the arm? I think that's what we're all kind of used to, or the not normal, but the present day that we're kind of used to.
Ideally, you want to create, the surgeon will create a fistula by connecting a vein to an artery. And that usually takes up to 12 weeks to be ready to maturate for dialysis. With this new procedure, we shorten the maturation time to 4 to 6 weeks.
Wow.
We create a low to moderate flow fistula, which it will be easier to maintain than the regular fistula. It will last longer.
Now, is your entrance point still in the arm, or is it near the kidney? Are the kidneys over here, doctor?
Yes, in the low back.
I have to ask you.
Well,
because
ideally, you want to create what is called a cephalic vein fistula.
Okay.
It's one of the veins that run up the arm. And the only issue with the creation of that type of fistula is the cannulation. But as an interventional team group with the dialysis center team, we can assure the proper cannulation of this type of fistulas. Once we get at least 3 times the proctoring of this type of fistula, the patient will be home free to get it just with the team at the dialysis center.
That's great. This is a great new treatment that you brought to South Florida, Dr. Sanchez. It's Dr. Carlos Sanchez. He's the chief of radiology at Hialeah Hospital. And are you also on staff at Coral Gables Hospital?
I'm the chief of radiology there too, yes.
Oh, wow. Back and forth, huh?
Back and forth.
And then over here in Boca Raton for a radio interview?
Well,
wow. You're a passionate man. No, you got to be, right? Because like you said, you want to bring this to dialysis patients. You want to give them this opportunity.
And the opportunity not only for dialysis patients, to educate people that they know that if they have family history of kidney disease, hypertension, diabetes, they need to make aware the doctors that they have these type of problems, because if you're living with kidney disease, you should prompt attention to these type of matters. Don't wait until it's too late. Don't wait until you crash into dialysis, get a catheter that is not good on an emergency basis. Consult your primary physician if you have family history, hypertension, or diabetes.
And we have a few doctors who watch this show, so we hope those primary cares will hear what you're saying. Dr. Sanchez, hold that thought. It's hard to believe we're already halfway through, but we're going to take a quick commercial break. On the other side, we're going to talk about a little bit about your practice there in South Florida on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor's show, Living a Longer and Healthier Life. We're here with Dr. Carlos Sanchez, Chief of Radiology at both Hialeah Hospital and Coral Gables Hospital here in South Florida. He's got a private practice as well, and we will talk about that. But I just want to continue that conversation. So the name of the procedure, and I almost got all of it down during the break, is percutaneous arteriovenous fistula
Creation.
Okay, percutaneous
Arteriovenous fistula creation.
Thank you.
You can call it percutaneous ABF.
Okay, let's do that. Percutaneous ABF. And this is being done at Hialeah Hospital right now. This is for kidney disease.
It's for dialysis patient with kidney disease.
Okay.
And Hialeah Hospital is the only hospital right now in the state providing these kind of services.
That's great. And it's HialeahHosp.com. The city of Hialeah, HialeahHosp.com. Or you can find it online. Just Google it or Facebook, 305-693-6100. If you have any questions, the team there can help you out. And that's located in Hialeah, 651 East 25th Street. Great hospital there in the community of Hialeah. I've been there many times as a visitor, not staying there, but for medical care, but as a visitor. But so I wanted to ask you a little bit also about your private practice. Now, interventional radiologist, my way of thinking, it took me a couple minutes to find your private practice online, because I think I was thinking that radiologists, a lot of them, do they have private practices?
As interventional radiology,
it's a little different, right?
It's a different perspective. I do have an office, an interventional office that we do see patients as a clinic, as endovascular surgeons. We do patient evaluation. We do minor procedures, and from there, we organize the way patients are going to go to the hospital in the inpatient and outpatient setting.
That's great. And I'm going to give it out here. PrecisionHealthCenters.com is the website.
That's correct.
There's a ton of info there. The number there is 786-615-2027. I give out all these numbers and websites because a lot of people actually go back to these shows and use it as kind of a Rolodex, and because you never know what could happen to you, or like you said, friends or family. We kind of mentioned that. Now, that is your office, and that is located in Miami.
Miami, that's correct.
Okay.
It's very close to Coral Gables.
Okay, 2975 Coral Way, Miami. Love that area near Coral Gables. That is awesome down there when I get a chance to get down there. Why did you decide to become a radiologist? I mean, obviously you're very passionate about helping people. I can definitely catch that from you.
Well, I believe that I'm a mechanic at heart. And when I went to radiology, I was not just amazed about the imaging modalities, but I was anticipating the use of imaging to repair. So when I went to radiology, I went with the mentality that I was going to repair abdominal aortic aneurysms. So that was my initial passion, to help patients in doing it in a minimally invasive way. That surgery typically was brutal, big incision in the belly, moving intestines out of the way, exposing the aorta, and the recuperation, if this patient will make it, will be at least a month in the hospital. Right now, we do this type of procedures in a minimally invasive way. Recuperation is very short. It's relatively safe. The procedure is done in 45 minutes or an hour, and patients they live through it, and they do good.
That's great to hear, because I actually interviewed a patient once for a testimonial, and I'm not kidding when I told you, he said it was close to a 10-hour surgery. Can that the open way of doing it, the open treatment of, I believe it was abdominal.
The conventional surgical procedure would be opening the belly up and exposing the aorta through big incisions.
Wow.
We do that essentially the same type of surgery, but just doing minimal invasive, tiny holes.
Yeah, that's great to hear, because one of the things we started with this conversation was minimally invasive, less chance of an infection, quicker return to quality of life. I think it's better for everyone. Maybe we'll save some of your mileage there. That's that's important. We've had a lot of doctors sit here, and
I think that is very important to let the doctors and patients know that we are here,
mm-hmm.
and we are here to provide an excellent service for the doctors and the patients.
That's great. We're here with Dr. Carlos Sanchez, interventional cardiologist, and he's at, you're the chief of radiology at both Coral Gables Hospital and Hialeah Hospital, two great hospitals with the Tenet Health Network here in South Florida. It's HialeahHosp.com, HOSP, and CoralGablesHospital.com if you want to learn a little bit more about the hospitals. Dr. Sanchez is doing this percutaneous arteriovenous fistula.
Let's call it percutaneous AVF.
I almost got percutaneous AVF. There we go. At Hialeah Hospital, 305-693-6100. Where did you complete your education and training?
I did diagnostic radiology residency in LSU.
Oh, Louisiana State University.
Louisiana State University.
In Baton Rouge?
No, actually, New Orleans.
Oh, nice.
Yes.
That's awesome.
And from there, I came down here to UM.
Okay.
And I did my fellowship in interventional radiology at Jackson Memorial Hospital.
Oh, yeah. Great.
It was a great experience.
Great institution. I was reading an article about that hospital recently, and said that the largest number of beds in the U.S. Is that possible right here in South Florida?
Yeah.
Wow. Bigger than L.A. and New York. That is a great hospital. We've had a lot of doctors on here from Jackson, and yeah, that is a great institution, and their tie into UM with the teaching hospital. That is great. So, boy, you have all the accolades: residency in diagnostic radiology and fellowship in
interventional
radiology. That is awesome. Dr. Carlos Sanchez here with us, interventional radiologist in the Miami area. But I feel like once people see this show and listen to it, I mean, you may have people traveling from all over to visit you. I hope that's the case, that people can find this is state of the art care going on right there.
Yeah, I think that we can make a change, and I think that it's a call for action. I think that it's not just a local problem here in the state of Florida, but it's across the nation. I think that these patients deserve to get more than 20% the fistulas. I think that we need to facilitate them the way to be treated. And this is an awesome option for them. They don't need medical clearance. This is just an outpatient procedure. The only requirement is to be anatomically adequate for this, and with that we do a venous mapping. And if you're a patient and you're a candidate for this procedure, we can do as soon as a week after we determine that you are good to go.
Yeah, so give Hialeah Hospital a call, 305-693-6100. or Hialeah Hosp, HOSP.com. And yeah, see if you could be a candidate for this percutaneous
BF.
BF. Well, I'm going to get it by the end. We only have one more minute, and I really liked your answer that I asked you before we went on. What are your hobbies in life outside of medicine? And it's still medicine, right?
Well, it's still medicine. I like sculpting.
Body sculpting.
Body sculpting through Smile Lipo.
That's great. And that's at precisionhealthcenters.com, 786-615-2027, down near Coral Gables in Miami, 2975 Coral Way in Miami. And obviously bilingual in English and Spanish.
Absolutely, yes.
That's great, too. Dr. Sanchez, thank you for making the drive. I know you didn't drive just to drive through traffic. You're very passionate about your specialty.
Thank you, David, for having me in.
Let's have you back on in the future.
Absolutely.
Thank you. And we'll see you next time.
Thank you.
Thank you for letting us share with you a longer and healthier